Okay. So then I think from this call, I think we can assimilate some of the comments here on this slide. And as Lee pointed out, especially for people who do not see children regularly or all the time, is to keep some education, at the elbow initially, and then often since then, for me, I don't know about the rest of you, but I'm a very visual person. I like to have a messy desk because I like it in my line of sight. And then I tend to remember things better. We do have the toolkit materials right on the website, and we're hoping in 2021 we get better engagement from individual providers with the Medic website. So even on an ED shift, I typically go to that website and I download things right there for my medical student. I did it yesterday. For my PA, I did that just about a week ago, to just point them in the direction of, this is what we're doing, this is how you can consider this. That often helps. And then when you're on shift, when you get an opportunity to do that with an individual patient, to remember that, the trainees and the APPs, everybody wants to move the emergency department and do the right thing. So, but they may not have the granularity that you do, and maybe hitting pause there for a second to make sure everybody is armed with the right information. I think the other piece here is good provider feedback. If possible, sometimes, hitting the provider as they're getting ready to order, before they order. And then, of course, giving feedback to providers, even at a time remote from the ED visit, in some summary situations. Some of our clinical champions do that regularly. And then to provide some, as Helena pointed out, we're gonna, think about providing blinded and unblinded, summary performance data at your site, and particularly for your individual providers, if that's a sticking point. And then looking at their performance over a larger period of time for sites that have very low volumes. And then using shared decision-making tools. There's been some evidence now already in the medical literature about some of these tools that have come out, and with some mixed reactions, but basically they do help families really process a lot of this complex information and come away with some sense of reassurance, as Helena pointed out. Even in that intermediate risk, which is what we're working on, the incidence of serious traumatic or clinically important brain injury is actually quite low. So, if nothing else, encourage your local providers, even not certainly your clinical champions know this, but for all the providers at your site, to really dig into the Medic registry. You can see where you are at. And then the typical things that you can do on the fly. If you can't, there are some sites that actually have some Google blocks to be able to get on and use some of these things that we've talked about, like MD-Calc at a given site, in order to just protect their site. But MD-Calc is very easy to use, and I feel like it's my go-to quick, if I don't have the Medic website immediately up, or I'm busy, I can send someone to go do that, to navigate it very quickly. And it's usually met with some very positive reaction. Okay, so thank you all very much for attending. We've got 57 people on this call, which is nothing short of amazing. And just remember, we're in transition with our website and our registry, and we're going to be, the toolkits are actually still up there now, but and that is not password protected. You can access that anytime. But we totally expect that you might process this information. Some abstractors might take this into their clinical champion or providers, and you might have some follow-up questions. By all means, please email us. Our goal here is to cut the time to improvement for even the most difficult problems and challenges that you face and barriers. So we have one comment I just want to bring to the point. I think Chelsea Weiler, to the panelists, if you can just comment on this. She says, I think it is important to recognize the ability to provide a good age-related physical assessment as another important factor in decision-making. Many providers that are at mixed sites may not see as many good-looking kids, and this makes it harder to decide to scan or not. In other words, having that. I don't know, Helena, if you wanted to comment on that or not.
Well, I mean, yes. I mean, a good age-related physical assessment is definitely very important, right? I spend a lot of time talking to my PAs and residents in regards to, like, an age appropriate neuro exam for a child, or for kids of all ages, and how do I do dysmetria on a 6-month-old? Well, we talk about that. They can reach for a pen light. So I think I think that's definitely very, very important. And that's really just about probably volume of seeing more children. Unfortunately, in some EDs don't see a lot of children, and so there's when you don't see a lot of children, sometimes you again tend to act on the side of conservative and wanting to make sure that the child's not seriously injured. We see T. So I don't have a good answer for that when your volumes are lower. I don't have a good answer as to how you mitigate that risk.
Yeah, something to consider, and definitely we'll take this into medic too, because I think this is a little bit more granular than we've gotten before, and that's a great thought process, Chelsea. Glad to hear it. Okay, we are closing in on the hour. It's 1:54. All of our slides and notes will be sent to all the attendees on this call, and we'll take out all the confidential performance data. I think if nothing else on the call, a couple of things that I think are important is, especially for this measure, is for providers to really engage in their performance data. So once we get over the hump of this registry change, I think that's going to be very helpful to everybody to take a look at their performance. I want to say thank you again. We're all in for head injury this year. And we're going to potentially come back to this, and I have a few more tidbits for the collaborative as we kind of march forward. But I want to say thank you to everybody. Thanks to the medic team for all of your work trying to get us together. And by all means, one of the goals is, again, to reach out to one another. So please feel free to do so, or contact us to link towards somebody else you heard or saw on this call. So thanks again, and have a great day.